Next, I have the honor of introducing our next two speakers on antidotes and countermeasures. Greg Nelson is a pharmacist at Primary Children's Hospital, the Intermountain Health in Salt Lake, Utah, and is a very active member in RAPM and the Seaburner Group. And also accompanying him is Maureen Rowland, the director of the Banner Poison and Drug Information Center located at University Medical Center in Phoenix. So take it away, Greg.
Thank you for that great introduction. So I'm here to talk to you about some chemical countermeasures. Dr. Goldberg did an excellent job talking about the number of patients that you're going to see and what you're going to be doing in the clinical area. But one of the things that is really important is to know some of your chemical countermeasures for that. Also in this presentation, I've got a bunch of QR codes in there that you guys can scan for going to the websites that I am referencing. So I hope that is helpful. When something big happens, where do you get what you need? You know, you're getting this huge influx of patients. There's three things that you need: space, staff, and stuff. As much as I would love to raise my little pharmacy wand and wave it and make all three of your dreams come true with that, unfortunately, it's not possible. But with the stuff, there is access to more resources than you might anticipate with those some of the resources in your community. Depending on where you're located at, whether you're very rural and you've got a long transport time, or you're in an urban setting and your vendor or something like that is across the metro area, how are you going to be able to do that movement of what you need, that stuff, in order to get what you need? The first couple of hours is always super important. The first 15 minutes is extremely important, but that first hour or so is however well you have prepared yourself, whether you're an EMS agency or a hospital. So really what I'm going to be looking at here is that 2 to 4 hour window when I'm talking through some of this. The first one that I'm going to talk through is the Chem Pack. If you're not familiar with it, I would suggest learning more about it. It's a really cool program that has a whole bunch of containers around the nation, and they're usually at a fire station or a hospital. And the theory behind it is 90% of Americans are within 1 hour of that Chem Pack. Wherever they're located at, they're monitored for temperature, for humidity, and if they're being moved or opened, there's a little telephone cord that plugs into the container that you see there on the right and into the wall, and they're monitored from a central monitoring location from the federal government. And when you get into these, they're to be used for patient care. But as Dr. Goldberg referenced, there's a lot of stuff in here. And so when you activate it, or if it is activated, make sure that you're referencing your hospital plan for that activation. And maybe even it will include the state plan. Everybody's got a little bit different one. The last thing I would want is a patient to die that's within a stone's throw of these resources that you may or may not know. It's not important necessarily for the full ER to know the exact location and closet that this is in. They just need to know that it's available, and that it's something that if an attack or a patient surge came through, that you'd be able to access that. The Chem Packs, there's two different varieties of them. And I'll speak in general terms here. There's an EMS and there's a hospital, and they're geared towards your care location. The EMS has more unit of use. There's auto injectors, things like that. The hospital has more multi-dose vials. And so the EMS version, I don't know why it's 454 casualties, not 450 or 500, but hey, we'll go with the 454. And the hospital one is geared for 1,000 casualties. And so there's a ton of stuff in here. You can see the counts and stuff on the packs here on the list. And from different states, they have this information out there for the activation plan. Within the Chem Packs, there's a couple things to know. I used to have to explain what an emergency use authorization is, but after COVID and the therapeutics there, everyone in the country has learned what EUAs are. And the other thing to note when you're pulling these out is that your vial may show that it's expired because it's monitored by temperature, because it's monitored by humidity. They can take that lot and continue to monitor it and extend that expiration date as long as it's good until it needs to be swapped out. It's really important, though, that whatever you're treating, that you've got those care algorithms to be able to treat patients and be able to use those contents. and you also need to practice this. It's amazing when you do simulations and you have people actually drop the med and do a 3-minute slow push of a med, of how that changes the simulation, because how much time it takes to draw that dose up and manipulate it and prepare it to be given really does take a lot of time. How are you going to give these meds to patients? Do you have syringe pumps in order to give those? It's what we use here in our ER, but I know a lot of adult facilities have very limited numbers of those. And are you ready to do the math? The adults, 1 vial, 1 dose is kind of the general rule. Peds, some of the vials, depending on how small they are, I may be able to get 10, 15 doses out of that 1 vial. And so you've got to be able to know how to do that and be able to do the practice with it. But the sims are where the money's at, where people actually learn what's doing. I do a lot of the medication preparation for the nurses here in our ER. And I love it in the sims when I take the airway and make the nurses do the medication preparation, because they realize how much more time and how much more thought process there is in that. So be sure you include that in there. But where do you get those care algorithms for things that you don't normally see? I've worked in a pediatric ER for 9.5 years, and I've not seen an organophosphate mass exposure. So this is something that really needs to be practiced. But when you're getting those care algorithms, look at the Chem website from HSS. It's a great program that has a whole bunch of information in there. There's initial response, hospital response, pre-incident planning. There's a ton of different stuff in there that I would highly suggest that you go through beforehand if you're not familiar with this website. In the top left, near the top, I guess, there's a first responder and there's a hospital tab. And those are really important for each caregiver, whether you're an EMS agency or you're in the hospital, because it gears that information to it. There's a lot of PEDS information in here, as well as the general adult. And it takes some time to go through it all and kind of dig through it, because there's a lot of information, but it's a great resource. One of the things that I want to highlight from the Chem website is the Chemist tool. And you go through and answer a series of questions on what you're seeing with your patients, and it can give you a higher probability of what kind of agent is being or has caused the toxic condition in those patients. And now, it isn't always correct, it just gives you those probabilities, and it also depends on what you answer of what that goes through. And so it's a great resource that you can go through yourself on your phone, on a computer, wherever, try to figure it out. But what's better than trying to figure it out yourself and going through this website and whatnot, if you're not doing that, is to be able to tap into a toxicology expert. And that's where the poison controls really come into play. Maureen?
Hi, thank you. And thanks for having me. I kind of piggybacking here on to Greg's presentation, but who better to talk about poison centers than somebody who works there? So for anyone who's not aware of the excellent poison center system that we have in the United States and actually internationally, this is 24/7. We are registered nurses, pharmacists, and physicians that answer the call at any time. And we are experts in toxicology. So we are specially trained. I don't know if you saw in my title, I'm a certified specialist in poison information. That's what we're called. The staff that answers the phone, we're called SPIs, specialists in poison information. In order to work at the Poison Center, you must become certified. That's part of our accreditation. So we are specially trained in toxicology. The likelihood of an event happening and the Poison Center getting called is pretty much 100%. So either way you look at it, whether your institution gets involved and makes plans with us from the beginning, or whether we're calling you when an event has occurred, we're going to be involved no matter what, whether it's EMS calling us from on scene or just the public calling with concern. We always have 24/7. We have a medical toxicologist that is backup call for us. Some centers, including the center where I work, we actually have admitting services. So our physicians have admitting services at our institution, Banner University Medical Center, Phoenix, and then also at the Children's Hospital. So they have admitting rights at Phoenix Children's Hospital. So we cover the gauntlet as far as admitting patients here in Maricopa County. Next slide. So one of the unique things, again, that I don't think many people are aware of is that we actually are partners with the CDC for the National Chemical and Radiological Surveillance Program. And what that entails is our national poison data system. So every single call that any of the accredited poison centers get, we put into a unique EMR that is uploaded into this national poison data system real time. So about every 7 to 8 minutes, our cases are uploaded into this NPDS. The NPDS is monitored 24/7 by CDC epidemiologists, physicians, and then also some poison center elected officials. So 24/7, they're watching for any sort of anomalies or algorithms that are put into the system. So if it's maybe a cluster of events, so we can identify if there's perhaps some tainted drugs that are out on the street or certain gases. So for example, our center received a call from a air conditioning mechanic who was exposed to a phosgene gas when he had heated a certain element. And when that spy put in the case to our EMR, I, as the director of the Poison Center, got a call from the CDC about 5 minutes later to say, why do you guys have phosgene gas in Maricopa County? What's going on? Do we need to notify public health? So this is real-time monitoring that is in the United States, really the only real-time monitoring that we have for these sorts of incidents. So that's, again, where poison centers are uniquely involved in any sort of cases like this. Next slide. Great. So the other great thing about poison centers are part of our services, part of our accreditation is to provide education and training to the public and healthcare professionals. So if you haven't already, I highly recommend reaching out to your local poison center, asking them what services they are already providing, or if you need additional training. Again, this is our expertise. We are toxicology. This is exactly what we do. We can help with disaster coordination too. So another example with our center, we recently had the Super Bowl here in Phoenix. And so we participated in a couple tabletop exercises. We had a really great one where we had the Department of Homeland Security that came out, and we looked at chem packs and identified where all the chem packs were in the state. We have one here at our facility too. And we kind of went through, how do we get that to the patients that need them? What do we do with the surge? And it was a really eye-opening event. We actually created some protocols based on that tabletop exercise. So I highly recommend those. And again, reach out to your state's emergency response team and ask them. I mean, I think that's a great idea to know where are all the chem packs located in your state and how would you get to them if you needed them. And then also we can assist with administering those medications. So, quick phone call away, and this is what we do. So we can help with the dosing, providing that guidance. And then again, one of the biggest parts of poison centers too is we always follow up too. So we are constantly, calling back, making sure that there's no further treatment recommendations, or if there's something new that occurs, we can give advice on that. So again, this is at your fingertips 24/7. Utilize your poison centers.